Okay, we are good to go.
Okay, so good evening, everyone. Welcome to the May 13, 2021 meeting of the Community Board 6 Health and Human Services Committee. My name is LV Barroso and I'm the chair of the committee. This meeting is called to order at 6:34 p.m. Tonight, we are joined by Community Associate Brendan Bird. Members of the public, you can raise any questions or comments that you have through the Q&A feature of Zoom. If there is time following the committee's discussion, we will field questions from the public. Marty Barrett has volunteered to take minutes tonight. Thank you, Marty. And we will now take the attendance by roll call. Brendan will conduct the roll call.
Committee members, I will call your name and you will unmute yourselves. When your name is called, please say present. I will announce if there is quorum. Marty Barrett. Okay, I do see Marty here. Elvie Barroso.
Present.
Dan Devine.
Present.
Rich Mintz.
Present.
Raj Nayar.
Present.
Anju Suresh. Okay, I don't think Anju is here. And Ronnie White. Doesn't look like Ronnie is here either, but we have quorum.
Okay, so the agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, you may raise your hand through Zoom. Seeing no objections, the agenda for tonight's meeting is adopted. The minutes from April 8th meeting was distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object adopting the minutes, you may raise your hand through the Zoom. Seeing no objections, the minutes from the April 8th meeting are adopted. They will soon be available on the CB6 website. In order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. Committee members, if you have a question about committee business or wish to make a motion, please raise your hand through Zoom. If you click the participants icon, the participants panel should appear, and you should find the raise hand function there. If you still have technical difficulty, you may click the chat icon and relay your difficulty. The chat function should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information that was already stated aloud on the record during the meeting. When a committee member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. We are required by executive order to create a verbatim transcript of the meeting. So please keep your questions and comments succinct and germane to the discussion. Tonight's agenda, we have a presenter from the New York Project Hope on their crisis counseling response to the COVID-19 pandemic. Let's welcome Mr. Alex Gomez. Mr. Alex Gomez is a proud United States citizen born in Colombia who immigrated at the age of 5 with his 2 siblings and their single mother. Raised in the South Bronx, Alex learned early on the value of hard work, teamwork, and perseverance. Alex graduated with a Master of Science in Organizational Leadership and with a Bachelor of Arts in Political Science from the CUNY Lehman College. Alex has spent the last decades in the social service, youth development, workforce development, mental health services, and supportive housing field, working with New York City's youthful offenders, with underemployed and unemployed youth, young adults, and adults, in addition to volunteering for a variety of charitable causes. Alex is currently the director of New York Project Hope at the New York City Department of Health and Mental Hygiene. He is overseeing the citywide implementation of a crisis counseling program funded by FEMA and administered by the New York State Office of Mental Health. New York Project Hope is a statewide crisis counseling response to the COVID-19 pandemic to help New Yorkers recover from the challenging effects of COVID-19. In November 2017, Alex ran an independent candidate and appeared on the New York City general elections ballot as a candidate for New York City Council. Please welcome Mr. Alex Gomez.
Thank you, LB, for the kind introduction. It's a pleasure to be here with all of you this afternoon, this evening. I'm going to make it real quick, and I know you have a lot of business to discuss, but thank you for allowing us to participate in this panel and your meeting. I am honored. So my name is Alex A. Gomez. I am the project director for New York City Project Hope on behalf of the New York City Department of Health. I'm going to share my screen. Let's hope it works. It was just working right before we started. So let me know if you see my screen so that I can proceed. Yes? Okay, awesome.
Yes.
I'm gonna just, let me expand it here. So New York Project Hope is the response to COVID-19 pandemic. New York Project Hope started as a helpline at the state level in the governor's office in March of 2020. In June of 2020, it was moved over to the New York State Office of Mental Health, and New York State Department or the New York State Office of Mental Health received funding from FEMA to provide these services as a crisis counseling program, similar to two other programs that you probably have heard of. One of them was the Project Sandy right after Hurricane Sandy in 2012, and Project Liberty right after 9/11. So FEMA funds these type of programs, usually in person, to respond to a natural disaster or crisis. The difference was that this was a virtual response because of the COVID-19 pandemic. But now that a lot of New Yorkers have been vaccinated, some of these services are now being transitioned to in-person. And I'm going to explain to you a little bit more about what those services are. So just going to move to the next slide. So what is New York Project Hope? New York Project Hope is the statewide crisis counseling response to the COVID-19 pandemic to help New Yorkers recover from the challenging effects of COVID-19. So just to make a couple of clarifications at the top, New York Project Hope is serving New Yorkers regardless of their immigration status, regardless of their age, regardless of where they live in the 12 counties of New York State. We are providing these services in multiple languages, again, both virtually over the phone and in person. So the first thing is the helpline. So the helpline is available Monday through Sunday, 8 a.m. to 10 p.m. And it's available in multiple languages. If someone calls in and doesn't speak the language that the crisis counselor speaks, we can use either the translation line, or we can connect them to a crisis counselor that does speak their language. The helpline is a statewide number, but each of the counties and each of the providers, specifically here in New York City, have a dedicated helpline as well. So there's a number that they can call directly to connect with a provider in their neighborhood or their backyard. The providers are nonprofit organizations that have been working in our communities, specifically in communities that have been hit hard by the pandemic, and communities that normally or have over the years had a lot of challenges, or serve individuals who are either have the needs for these services or where there's high need for these services. New York Project Hope is also providing services to children as young as 3, or any child who wants to speak to a crisis counselor can speak to one, as long as the parent is available and present to give permission to the child or give permission on behalf of the child. These services, again, are available over the phone or in person. So some of the things that have come up during the pandemic is, how do we as individuals deal with stress, anxiety, isolation? How do we feel with our emotions? And the crisis counselors are not social workers. These are paraprofessionals who are trained through SAMHSA, through FEMA, through the Office of Mental Health, and through the New York City Department of Health to provide crisis counseling services. I would say in layman's terms, these are individuals who are there to listen, to hear, and to give some feedback to individuals who need someone to talk to. This service is free, it's confidential. We do not take down any information that will identify anyone. We do not keep track of the telephone number or their name or any email. We only ask individuals to give us their zip code and their race and ethnicity to track the services that we've provided. So New York Project Hope helps individuals with how to react to some of these feelings, emotions, and how to cope and deal with the challenges that have been brought on by the pandemic. So some of these crisis counselors will be able to not only connect individuals to resources in their community, but will be able to listen and provide some feedback and some resources that are available on the website or in the community that those individuals are located. The 5 boroughs and across the New York State, we have providers that are providing the same services simultaneously. They're going to be providing public education workshops. They're going to be doing both group counseling and individual counseling. In addition, we've been providing services and will continue to provide services virtually and in person to schools or to children in schools. We've identified over 220 different public schools here in New York City that are underserved or do not have any kind of mental health services or crisis counseling services. And we are providing these services through our providers. Again, we have 21 providers across the 5 boroughs. The services, again, are free, they're confidential, and individuals can call at any time or access our website. NewYorkProjectHope.org or NY Project Hope is the website. On the website, there's a lot of resources, coping strategies. There's even a button that you can click and connect to a crisis counselor and speak to one at any time between the hours of 8 a.m. and 10 p.m. If you call the crisis counseling helpline, you will be speaking to someone at the level, but they can connect you to someone locally in your own neighborhood. How to access traditional treatment? Well, like I mentioned before, these are not social workers. These are not mental health professionals. These are paraprofessionals who are trained as crisis counselors to listen and assist and refer individuals to services. Typically, if someone calls in, we only track if the individual has been in a session for more than 15 minutes. If someone self-identifies that they've been in a session or have had multiple conversations with the crisis counselor after a third time, we then can refer them to traditional treatment services in their community. We also let everyone that calls in that they can contact their insurance provider, that they can ask for a list of in-network providers or speak with their primary care physician to access traditional services. So again, this is not a replacement for mental health services. This is crisis counseling, and we assist individuals with getting those resources as needed. So through public education and emotion, and through the emotional helpline, we give individuals an opportunity to understand their situations and reactions, how to identify labels, how to express their emotions, how to regain a sense of mastery and control, how to make decisions and take action. And the crisis counselors are able to help individuals develop coping strategies, manage their stress, adjust to the pandemic and losses, and use community resources. Again, there's a ton of resources on the website. Each crisis counselor also has access to a database that provides access to a lot of different services in their community, from legal services to eviction prevention, to accessing a food pantry in their neighborhood, to accessing job placement, or other services that an individual might need. Like I mentioned before, our crisis counselors can also connect individuals who are undocumented to all of these services. Your immigration status is not important or not necessary when providing or accessing these services. So a lot of our information is on social media. You can catch us on Facebook at NY Project Hope, or on Instagram. You can also log in on our website, like I mentioned before, nyprojecthope.org. We also have TikTok and other forms of social media, including Twitter. So make sure that you follow and connect with us for more tips and resources. So the emotional support helpline that I've been mentioning is the number that you see on your screen. That's 844-863-9314. Again, confidential, anonymous, and free. The service is available 8 a.m. to 10 p.m. every day, Monday through Sunday. If you want to connect with a particular provider in your backyard, in your neighborhood, you can go on the website under provider agencies. If you go down to the bottom where it says, what county do you live in? You can click the county that you live in or the county that you want to access services in, and it will pull up the providers in that particular county. What you're seeing now in front of you is the list of providers that are across New York City that we've connected with and that we are in partnership with and have contracted to provide these services. Each of these providers has a dedicated helpline. Maybe you have heard of some of these providers because they've been in the community for a very long time. And they've provided services across New York City for a multiple amount of time. Again, you can find a ton of resources on our website, nyprojecthope.org. The emotional support helpline is 844-863-9314. And if you would like another presentation or know someone that needs this presentation, they can connect with me by email or telephone. My email is on the screen. And LD can also share my information after the presentation. We are also, like I mentioned before, providing crisis services in schools through workshops to administrators, teachers, and staff. We're working closely with school parent coordinators, guidance counselors, and social workers so that they can use these resources with parents and children and staff across New York City. So all of these services are also in person. They hybrid between virtual and in person. We are making presentations at PTA meetings, recreational activities that we put together. And again, we're providing coping tips and techniques and mindfulness exercises. So all of this is actually being provided and done by our crisis counselors across the 5 boroughs. Just wanted to give everyone a reminder about how to prevent the spread and continue to follow the guidance from the CDC and the New York City Department of Health. And you probably have seen this before. To get information about vaccination, you can go to nyc.gov/COVID vaccine. And again, I would like to thank you for this opportunity to connect with you all. We do have a flyer that I can share with you. I can email it to LV, and you can share that with your friends, family, colleagues, and loved ones. We're also launching a campaign this week. So you'll see our ads on trains, billboards, bus stops, and on TV and on the radio. So definitely share the information. And again, we're here to talk, listen, and to support New Yorkers through this pandemic. The services are available again in multiple languages. We will be providing these services through the end of the year. This is a FEMA-funded program. And of course, it comes to an end at the end of the year, but we're, as a department, always looking for opportunities to continue to provide these services year-round post the funding. I will take any questions that you may have. And again, thank you for your patience with me and listening in.
Yeah, thank you so much, Alex, for bringing our attention to this New York Project Hope. Members of the committee, any question?
Marty has his hand raised.
Marty?
Yeah, for some reason, my microphone on the computer isn't working. So while I'm on video, I'm also on the phone. My wife worked for OMH for 40 years, retired, thankfully. Wonderful job. And she always thought that Project Hope was a fabulous project that does wonderful things. So really applaud you and trust that the funding will continue. Project Hope is not affiliated with Project Hope Charities, right?
No, Project Hope is a program funded again through FEMA and administered through the Office of Mental Health. Yes.
So there's certainly on the list of the agencies that you had listed, the Project Hope charities was not part of that. So that that they don't do the same kind of work that you do.
No. So I work on behalf of the New York City Department of Health, like I mentioned early on. So the New York State Office of Mental Health contracted here in New York City, the Department of Health and Mental Hygiene, to provide these services across the 5 boroughs. And we subcontracted to these 21 providers.
Thank you.
No problem.
Ronnie has a question. Ronnie?
Good evening. My question is, are the participants able to receive special referrals to specialists?
Are they able to request services from who? I'm sorry, I didn't understand the question.
From a specialist.
Do they get referrals to specialists?
Yes. So we connect individuals to services in the community based on the request that comes in from the individual who calls in. We are not. This is not case management, so we don't do follow up, but we do make referrals based on the conversation that is had between the crisis counselor and the individual who's calling in.
Yeah, I just want to add in relation to that. So these are paraprofessionals, isn't it? I'm just curious about how do they get their training?
Yeah, so the training is done online, virtually. SAMHSA has provided these trainings that are asynchronous, and there's also trainings that are done on a monthly basis and bi-weekly basis. These services are provided to each and every individual crisis counselor before they can even begin receiving or taking calls or going out into the community. Each provider has at minimum one team of crisis counselor, and a team is comprised of 6 counselors, a team leader, and a program coordinator. Some agencies have multiple teams of crisis counselors because they're larger or have the capacity to provide more services. But across the New York City right now, we have over 220 crisis counselors working throughout the city, both in person and virtually.
And also, does the training include making an assessment on when to refer or where to
Yes.
refer?
Correct. So there's 2 tools that are used. One is for children and one is for adults. And they're both specific to the need of the individual who's calling. The tool is only used after the individual has self-identified that there's a need and that the conversation leads to a referral. And that tool is used in every crisis counselor is trained to be able to use it properly and to then refer the individual to a service in the community.
And my other question is that, do you maintain a database on those that avail these services?
Yes, so there is a database that SAMHSA has provided us with. That information is entered and no identifying information other than the demographics of the individual are captured and where the individual was referred to. But that information is captured, and we do get daily, weekly, monthly reports from for each provider and for the crisis counselors that are providing these services.
Oh, very good. I think Ronnie has another question. Ronnie?
Hi. On the database, is that used to further treatment, better forms of treatment, or to address any sort of needs that hadn't been identified before moving forward and is that something that's reviewed on a basis more than annually?
Sure. So we do look at the data, and we are looking at event reactions and seeing what is triggering individuals to access these services. We do look at this on a, again, daily, weekly, and monthly basis. We meet with providers every Thursday for an office hours, and we have discussions with them about the types of calls that have been received, about the data that we've captured, and about the outcomes that have happened based on these calls and these sessions, whether in person or virtually. We do keep track of how many sessions have occurred, what type of referrals have been made, and the number of individual and group encounters. And we do adjust based on that. So yes, to your question, we use the data to adjust the services on an ongoing basis.
Brandon, any other question?
I actually have my hand raised, and it's not so much a question as much as a request, which is, Alex, if you, in addition to sending the flyer to Elvie, if you could also send it to me.
Great.
Really seems like New York Project Hope's resources could be of great use for CB6's monthly newsletter.
Sure.
You know, our community planning or our community health profile from a couple years ago says that suicide is something like the 4th leading cause of premature death in our district, only behind, I think, drugs, cancer, and heart disease. So, you know, anything we can do to promote mental health resources that are useful during this fragile time, I think would be good.
Sure. Definitely, we'll send both of you the information, and I appreciate, again, that the opportunity to share this resource. I've made plenty of presentations to small and large groups, and this is how we're getting the word out And now that we have finally initiated our campaign and we have a flyer, we want to make sure that it gets into the hands that need it.
Thank you.
You're welcome.
Yeah, thank you so much, Alex.
No problem.
Any other question? Seeing none, so I again, thank you so much.
No problem. All right, guys. Have a great night and a great meeting.
Yeah, you too.
It was a pleasure.
Thank you.
Thank
All
you,
right,
Alex.
bye-bye. You're welcome.
Okay, so now I think I'm gonna go to my report. So remember the plans about conducting a health forum. So instead of CB6 just doing it alone, we have decided to collaborate with NYU Health Langone Health. Our first meeting was held on April 27, and I met with Hannah Wade, the Director of Policy and City Affairs, and Stephen Grayson. He's the Senior Government Affairs, both of them from NYU Langone Health. And the plan is to offer a series of monthly virtual presentation from September 21 to March 22. And I want to share with you the plan. And okay, so this is just a plan, a draft. So we would like everyone to make comments about it. And probably what I'm gonna do, I'm gonna ask Brendan to send this to each and every one of you, and so you can think about it, and we can probably discuss more about it in our next meeting. So for now, I just want you to take a look at what we the outcome of our meeting. So it's going to be sponsored by CB6 and NYU Langone Health. And the title of the health forum, this is what we came about, but again, with your comments, we can make changes. So the title that we came about is, this is the one, Series on Healthy Living in the Community, presented by CB6 and NYU Langone Health. And our target audience, community members, those who are uninsured people, senior citizens, small business owners, working families, faith-based groups, key legislators, and parents with young children. So when it comes to the funding sources, we don't need, because it's going to be virtual. And the speakers are mostly coming from NYU and some probably from the Department of Health. So how often it is, it's going to be once a month, except for December. And these are the prospective dates: September 29, October 27, November 16, January 26, February 23rd, and March 30. And the prospective time is about 1.5 hours. So it's from 6 o'clock to 7:30 p.m. So 45 to 90 minutes. And these are the topics that we came about, but if you have some suggestion that we can add, or we can add and delete, or please feel free to do so. So the topics are long-term effects of COVID-19 and reinfection. Prospective month would be September, and also grief and family loss from COVID-19. In October, we have the mental health impact of COVID-19 on youth and adolescents, and prevention and emergency for youth on vaping and marijuana use. November, it's about tuberculosis versus COVID-19, and the importance or impact of cancer prevention and screening. January 2022, we're thinking about emphasis on sports health. Hopefully it's no longer about COVID. February, it's about catching early signs of Alzheimer care support program. March, health insurance enrollment and tenants, renters, and housing insecurity and prevention and prevent homelessness. So we might need more topics, most especially for next year, like January 2022, February and March, mostly January and February. So if you have a topic in mind, or if you want to suggest something that we can add on this, please feel free. The registration process will be done by us, CB6. And this is how we need our help. So we need to advertise, we need to promote. So this can be attended by bigger number, not just a small number. And the design of the program will be done by CB6. And we are planning to send out the invitation by July of this year. So please feel free if you have any comments. I'm gonna ask Brendan to send this to you, and we can discuss more.
Yes. I also see that Ronnie has their hand raised.
Thank you, Brendan. Hi, LV. This is a wonderful outline. Immediately, I thought of in our district, there were so many seniors and single people. Is there going to be any sort of addition to some of the topics related to COVID and dealing with loneliness and being isolated? Thank you.
Yeah, I think we can add that under the effects of COVID, or it can be under mental health impact of COVID. But I think that's a great addition. Actually, it's not just to the young and adolescent, but also to adults.
Absolutely.
Yeah. So Brendan, we can add those.
Sure.
Anybody else?
I see that Marty has his hand raised.
Marty?
Yeah, since women are the real center of most households, I would think that at least one session to be on women's health, women's mental health, because women make everything run. Men are kind of ancillary to the running of households and family life.
So
I would think a session on specifically on women's health would be much needed.
So should we add that to the sports in January? Sports health and women's health?
I would think that it could take a night for itself.
Oh. Well, we can put that.
It's something to think about.
Yeah, something to think about. We'll add that, and we'll ask NYU if they can get a speaker on that, because these are the what they think that they have already speakers on most of it. Yeah, but we'll ask them about that. Any other comments?
I just want to acknowledge that in the Q&A section, Rich Miller Murphy, a member of the public, has added some feedback about having a speaker for the health forum, or I guess about New York Blood Center having a speaker potentially for the health forum as they continue to have challenges in getting appropriate numbers of volunteer blood donors from the community. So I just want to acknowledge that feedback. I mean, that's also the sort of information that we might also want to run in our newsletter, potentially,
Yeah,
regardless of what your thoughts are.
yeah. What about the thoughts of inviting other community boards? Rich?
It's a good idea. I mean, I think we definitely should, because this is a good series.
Right. But how do we do that? Probably Raj, no.
I mean,
You know,
oh, go ahead, Rush.
yeah, well, I mean, I think that if we get in touch with the through our community board office, the district managers can probably have that discussion. It could even be brought up in a borough board that, you know, we are doing this, you know, forum or these series of discussions in the next, you know, several months starting in the fall. And that can probably get them to participate. You know, it could very well be at, you know, these borough board meetings that that information is disseminated amongst the various community boards, and then therefore, if they want to participate actively or they just want to, you know, attend, that would be great. But that's what I would think would be a good way to get that information out.
Yeah.
There are a couple of citywide bulletin boards like Orange You Going that various community boards use to publicize different forums and meetings, as well as many organizations use that. Also, Club Free Time, which does require a $20 a year fee, lists all sorts of talks besides various other forms of entertainment, theater, plays, movies, books, openings, etc. Both of those are always looking for additional entries. And certainly something like this, both of them would be fine with listing. And then it would go citywide.
Yeah, I think that's a great idea. How do we do that? We just make an application and pay the fee?
You don't need to pay a fee to do that. They're free. Posting is free.
Oh, okay. So we'll probably talk about that and make a list of how we can advertise. Now, so do we also need to attend meetings for other community board just to advertise this?
Yeah, I mean, I'll volunteer to do a round of
Yes.
meetings.
Oh,
Like,
yes.
I can go to some full boards and I can go to some health committee meetings as a member of the public. I'm happy to do that.
Yes, thank you. Thank you so much, Rich. Okay, so I think my next question is, do we want to hold a meeting next month?
It's up to you. You're the boss.
I'm sorry. In what context, LV? Is there why would you ask the question?
Well, I know we don't hold a meeting in the summer, isn't it? Like
Correct.
mostly June, July, August, unless it's there's something that we need to discuss.
Perhaps
You've been
it would
bringing
be good to have one to
terrific
have. Sorry about that, Marty. Maybe
No, that's
to have a follow-up on any additional subjects for the forum.
Okay, so probably we don't have to get a speaker for next month, and we can just discuss this one. And we will take off July and August.
Yep.
Is that good? Okay, so I just have one more thing that I wanted to show everyone. Hold on. All right, so this one. All right, so hold on. So on May 4th, staffing bills was passed in the State Senate and Assembly. And the purpose of the bill is to set and enforce staffing standards at every hospital and nursing home, regardless of whether the facility is public or private, non-for-profit or for-profit, union or non-union. So about 3 years ago, when I was the chair of Health and Education Committee, we tried to support this bill. So I met with the director of nursing at NYU, but since staffing was not a problem at NYU, they were adamant at supporting the bill. So this is the bill, the hospital and nursing home staffing bill. So they have 4 hospital, the hospital staffing committee bill that have all of these. They will establish clinical staffing committee, including 50% frontline nurses and direct care, and all of these. And they also have for nursing homes, the standard minimum nursing home staffing levels bill. And so once this is passed, the new laws will give nurses the tools we need to advocate for our patients and bring more accountability and transparency to our healthcare system. And but first they said that we need to make sure that Governor Cuomo signs these staffing bills. So the question is, how do we urge him to sign the bill? So the New York nurses, frontline healthcare workers, patients, nursing home residents can go into effect on January 1, 2022. So as Committee on Health and Human Services, what do we do?
First of all, sorry to interrupt, Elvie, but there's something off with your screen display.
Oh, what happened?
It's kind of blurry. Looks like you tried to exit out of a document but didn't completely exit.
Oh, okay. So let me stop the share and share it again. I think this is the one. Oh, nope. Okay. Is that showing up now?
Yeah, this is showing up.
Okay. Sorry about that. So do we, I mean, I'm not sure about this. Do we do something? How do we, Marty, you probably know what to do with this.
First, we need a resolution from the committee, which would then go to the full board. Can you hear me? I don't know.
Yes,
Oh, yeah,
yes,
I see
yes.
my thing is lit up there. We would need a resolution from this committee in support of the Assembly and Senate bill. And then that resolution would go to the full board, and it would go on its way. Insofar as getting the governor to sign things, well, the organization that I work for, that's their main mission, is for advocacy for support of people with developmental disabilities, intellectual and developmental disabilities, and lobbying is a big sport. We have a full-time lobbyist, but we've also recently hired one of the big gun companies that do this kinds of things that gets the kinds of bills and requirements in front of the governor or into the governor's office to the right people so that the governor would sign it. It would be too big a lift for us to do. But we could start with the resolution insofar as our own community board and how we're in favor of it. Nursing is a huge problem, and having the right staffing in all these different kinds of settings is a bigger problem. To have qualified nurses, or then for that matter, to have direct support professionals, which are the individuals who work specifically with the individuals on the front line, bathing them, feeding them, cleaning them. They get paid next to nothing. And finding individuals to do that work is becoming more and more difficult as the minimum wage has been going up, and these people have had in general been paid the minimum wage, and now you can get $17 an hour at Walmart and at some McDonald's. And so why do you want to work with somebody? You need a lot of empathy, you need a lot of heart. It takes a special kind of person. To setting standards for these kinds of organizations insofar as staffing, you may wind up closing them. And then the individuals who they were caring for will have to be picked up somewhere else if possible. It has been problematic.
The thing is that the big hospital that we have in our district, they're adamant about supporting this bill because they don't feel they have the shortage of nurses in the hospital. So, yeah. So
Well, they're very strong. The Hospital Association in New York pays more for their lobbyists than any other organization in the state. Well, granted, having Community Board 6 behind them supporting it, is another community group in their feathered hat, their nest. If anybody can do it, they could do it. They're strong. I mean, but certainly we could do a resolution.
okay. I think I saw Ronnie. Ronnie?
Hi, this, I think it's, I'm seeing the very bottom of a page, and it just jogged my memory that maybe something like this is considered a part of the infrastructure. And with the proposal that Biden is putting out there, it might be a good idea, since everyone is in favor of all the associations are in favor, it's probably because they are thinking about putting the lens of infrastructure on this, which totally dovetails and makes sense. And to approach and maybe structure a resolution and an approach to these offices with that, to remind them that this fits into that, might be a great way to frame the reso instead of just saying, this is great. Yeah. Is there anything that goes toward, and with the requirements, and this is for the professionals in there, are there like any incentives for like insurance and for education of the of the patients and their caregivers, and anything that can be wrapped around to be more holistic with regards to this. Thank you.
I didn't see anything about that. I will probably explore as well. But anybody who wanna take a stab in drafting a reso for this?
I'll do it. Send me send me what you have, and I'll put something together.
Yeah, I'll do more research and I will send you everything that's related to this bill. I think I saw again, Ronnie, you want to say something?
I was also going to take a look at it, and also maybe we can continue discussion next month as well.
Yeah,
That's all. Thank you.
definitely. Yes, thank you. Yeah, definitely. So next month, I'm not gonna get any presenter, and we can continue to discuss the health forum and this one. And I will send you, Marty, everything that I researched about this bill. So I think that's all my report. So any other member that has an old or new business?
We'll be able to take our masks off next Wednesday.
Anybody who's fully vaccinated can take off the mask when eating in a restaurant, indoor or outdoor.
I'm not ready.
Any other new business? Raj? No?
All good here. I think that having a discussion about this potential resolution next month is a good idea because it's not time sensitive, correct? I mean, they want.
I think the plan is this to take effect in January 1, 2022.
All right.
So we probably have time. Yeah.
Albany is going to close down soon. Albany closes down for the summer.
Oh.
Yeah.
Oh. So if we draft a reso, when is that gonna be passed? If we don't hold the meeting in July and August, so that means that it's gonna be September, isn't that?
Yeah.
So
Correct.
It would be September.
it's not gonna be late already?
It all depends upon what the Greater New York Hospital Association would be looking to do. But again, the likelihood of this being signed after 3 weeks from now is fairly remote.
Yeah.
Okay. All right. Okay, so any other comments? Any other? Okay, so I think Brendan, anything else?
Nope.
So if there's no objections, we will adjourn the meeting. It's at